Good afternoon, everyone, and welcome. Manitoba Start is the leading provider of career services to newcomers in the province of Manitoba and connects businesses to a world-class workforce. I would like to welcome you all to this FCR webinar series of live broadcasted events designed to assist you in entering the Manitoba labor market. Manitoba Start acknowledges that we are gathered on Treaty 1 territory, the traditional lands of Anishinaabe, Anishinaabe, Dakota Oyate, the Nusulin, and Nehitawak nations, and the homeland of the Red River Métis. We acknowledge that our water is sourced from the Shola Lake 41st Nation. As a newcomer organization, we commit to learning about the histories, cultures, and the rights of the Indigenous communities, to strive to build a respectful and supportive relationship for all. Today's webinar is focusing on the College of Medical Laboratory Technologists of Manitoba. My name is Luna. I'm the Outreach Coordinator here at Manitoba Start, and I will be your host for today's webinar. Given the large number of participants who have joined this webinar, we have muted your microphone to allow for better clarity and less interference. So before we begin, I will be going through a couple of housekeeping items. You can use the raise hand feature to indicate that you have a question or a comment after the presentation. And to do this, you can click on the participants button in the meeting controls and find the raise hand icon next to your name and click on it. And this will notify us that we have a raised hand. And Teams webinar provides a Q&A feature that allows attendees to ask questions specifically in the Q&A panel. And to access this, you just have to click on the More Options 3 dots button in the meeting control and select Q&A, and then you can type your question there. You can do the same if you're using your cell phone as well. Okay, so before I introduce our presenter for today, I would like to run a few polls to get to know you more better. So we will have 4 polls for today. The first poll asks, are you registered with Manitoba Start? You can click on yes or no, and then click on submit. Okay, now I'm going to close the poll and share the results with you. Okay, thank you everyone who participated in the poll. So we have 100% registered clients with Manitoba Start. Thank you. And the second poll asks, do you need help with a resume, cover letter, or interview preparation? Again, you can answer yes or no, and then submit. I'll give you a moment to answer. Now we will close the polls and I'll share the results. Okay, this looks great. We do have 60% yes responses and 40% no. So for those of you who need all this help and support, I'll be sharing some information that you can receive from Manitoba Start by the end of the presentation. Thank you. And we will have the third poll asking, Where are you joining us from today? Northern Manitoba, Southern Manitoba, Winnipeg, or outside Canada? You can click on your choice and click on submit. Okay, I'm closing the polls now. Okay, thank you everyone. So we do have 83% attending from Winnipeg and we have 17% from Southern Manitoba. Welcome everyone. Our last poll asks, what's your reason for attending this webinar? Are you an internationally educated professional, a settlement worker, or a career coach or other profession? Okay, now I will close the poll. We have a mix of attendees for today. So we have 38% internationally educated professionals, 13% settlement workers, 38% career coaches, and other profession will be 13%. Thank you everyone for participating in the polls. Today's webinar is with the College of Medical Laboratory Technologists of Manitoba. The College of Medical Laboratory Technologists of Manitoba, CMLTM, is the regulatory body of the profession of medical laboratory technology. The college sets entry to practice requirements for the profession, competency profile, education program standards, and examination, and ongoing practice requirements like practice hours, practice standards, and continuing competency requirements for all MLTS in Manitoba. The college receives and investigates complaints from the public or other health providers regarding MLT conduct and actions. So our today's presentation will cover the role of CMLTM current process to registration for IEMLTS, prior learning assessment steps and possible outcomes, options to fulfill learning gaps, and the eligibility to exams as well as for registration. And by the end of the presentation, we'll have client questions with the representative. So please welcome Jenny from the College of Medical Laboratory Technologists of Manitoba. I'll give you over to you, Jenny.
Thank you, and thanks for inviting me to do this presentation. Share my screen and we'll get going. So I'm going to run this slowly enough that if we have questions going through, feel free to ask, like raise your hand and Luna will let me know. Or type any questions in the chat and I can answer questions as we go, as well as provide opportunity at the end. So we can have lots of opportunity for discussion. So Luna, you went over a lot of the goals for today's presentation. So we're talking about who CMLTM is and the path to registration in Canada. what the current PLA process is through CMLPAR, the prior learning assessment outcomes, the exams, and then working while seeking registration, and then of course our contact information. So CMLTM is the College of Medical Laboratory Technologists of Manitoba. We are the regulatory authority of MLTs in the province, and we are mandated by the provincial government under the Medical Laboratory Technologists Act. So our primary goal and focus in Manitoba is to protect the public by ensuring that medical laboratory technologists are competent to practice and that they are professional, ethical, and all practice standards are met. So there are a variety of people who can be members of CMLTM. For active practicing MLTs, so anybody working as an MLT in the province, it is a mandatory requirement to be a member of CMLTM. There are optional memberships, which would be the MedLab students at Red River College and soon to be Assiniboine College. And then the retirees, people who used to practice MedLab technology and have since retired from the field but want to stay involved in regulation and the MLT community. So according to the Act, MedLab technologists are those people that practice medical lab technology, and they've gone so far as to define what MedLab technology is. So they're saying, according to the Act, it's the performance of laboratory investigations on the human body or on specimens taken from the human body, and that includes the interpretation of quality control data to verify the accuracy and precision of investigation results. And these results are for use by other healthcare practitioners in the diagnosis, treatment, and prevention of disease. So there are requirements to register with CMLTM initially. There are a few ways to achieve these. One is to be a graduate of an equal accredited MLS training program. The two in Manitoba, well, there's one in Manitoba right now through Red River College, and one that is opening up to new applicants in I think they can apply now, but school doesn't start till fall of 2027, and that's in Brandon at Assiniboine College. There are other MLS training programs in Canada, of course. The other way that's newer to our field is completing this flexible pathways process with CMLPAR. And the flexible pathways has a few, I guess, pathways to complete this prior learning assessment. So we can get into that a little bit more in other slides, but it's all about establishing equivalence in prior education and work experience to what the competencies are required to work in Manitoba as an MLT. And both of these pathways or options have to successfully pass the CMLPAR Field of Practice exams. So this is also new. It was previously, the exams were provided by another organization. And now as of like February or November, it was this past November. Now it's the CMLPAR Field of Practice exams, and that's a unique experience that we have because if you are trained specifically in, say, microbiology, for example, you can just take the microbiology exam after the PLA assessment and not have to take all of the specialties, depending on your education and experience. So Um, I would really like to have the best place to learn about CamelPer and the prior learning assessment is CamelPer itself and their website. They have lots of information on their website, but I'll do my best to provide sort of a broad overview of it. So CamelPer stands for the Canadian Alliance of Medical Laboratory Professionals Regulators. Um, so a whole bunch of regulators across Canada, not all of the provinces, but most of the provinces are members of CamelPer, and we recognize the CamelPer exams as the entry to MLT profession exams. And CamelPer now completes the prior learning assessments, which we refer to as PLAs. So when you go to the website, you can just go to camelper.org, or you can type in this /become an MLT, and it takes you through the process and the options available. Um, the flexible pathways arrangement, there's sort of two that I'm going to focus on today. One is international MLT education. So if somebody has taken traditional MLT program internationally, they would go through the PLA process as an internationally educated MLT. It's just a different lens that CamelPer would have and be able to compare the competencies to what we have competencies in Manitoba. Um, the non-traditional education, it could be internationally educated, or the education could have happened in Canada. And this is where the student took something that might not be a medical lab technology program. It could be a bachelor's in science or a master's or a PhD, a field related to med lab science, but not specifically med lab science. And again, people who have gone through this type of education would go through the PLA process with CamelPer in order to determine if they are eligible for the CamelPer exam or any of the CamelPer exams. So I'm going to go through the path to registration in the province. So I got this information from the CamelPer website. This chart on the right was sort of an example of a CamelPer prior learning assessment timeline. It is on their website, and they've given me permission to share it with you. So what they do for the PLA is CamelPer reviews the requirements. Nope, that's not right. Is that the website is there for you to review the requirements on the CamelPer website to help determine if this is the correct path for you. If you're not sure, of course, you can reach out to us or to CamelPer, and we can help you determine if the PLA process is right for you. There on the CamelPer website, the first step would be creating a Flexible Pathways applicant account. There is a fee for this. It's $175, I believe. And then with that account creation, you would get a CamelPer ID and a tool, a self-assessment readiness assessment tool. I have not seen it myself or taken it, but it's a series of questions that helps determine if the flexible pathways process is right for you. So then after that, if the tool and your own evaluation has determined that the PLA process is the perfect solution for you, you would provide required documents to CamelPer. And some of those documents would require meeting language requirements, transcripts from institutions. Um, it could be course contents from previous courses. There could be a variety of documents to provide. And it does take CamelPer some time to go through these documents. It's not a quick process. Um, There is a, oh, you know what, Luna? You asked me if there was a video, and I completely forgot. There is a video, but what I can do is, because we didn't test if it works. Do you
It's
want me
okay.
to
We can
test?
play it. Yeah, we can play
Yeah,
it
I
and I'll
can
let you
test
know.
if it works. We'll
Hmm.
see. It's a really good one. I completely forgot about it. Can you still see it?
Yeah, we can see it.
Okay,
Let's see if
I'll
we can
play
hear
it and
that.
yeah, I'll play it and let's see if we can hear it.
So no,
There's no
no, it's
sound for me yet
yeah. There's no
either.
sound. Maybe you can unshare and then when you share, just add sound. That will be when you share it. That will be on your right side on the top
Yeah, I
on the
think I'll
sharing screen.
I'll stop sharing and then I might have to stop sharing and then share again.
Yeah.
Is that okay, Luna?
Yes.
Can you see my
It's not.
screen now?
Yeah, we can see your
I
screen.
haven't played it yet. We'll
Oh,
play
okay,
it
perfect.
and see if it works.
Medical laboratory
Yes, it's
technologists,
working.
MLTs, are at the very heart of Canada's healthcare system. They work in laboratories in different fields of practice to provide expert information to prevent, monitor, and treat disease. Medical laboratory technologists in clinical chemistry analyze blood, urine, and other body fluids to detect chemical components affecting health. Their work helps to reveal metabolic diseases and hormonal imbalances, and provides data for the diagnosis and management of chronic conditions like diabetes and heart disease. In hematology, medical laboratory technologists examine blood components, blood cells, and coagulation proteins that enable practitioners to diagnose disorders. They identify abnormalities in blood cells and diagnose anemias, leukemias, and clotting disorders. They play a crucial role in the diagnosis, treatment, planning, and monitoring of patients with blood diseases. In clinical microbiology, medical laboratory technologists are like detectives, isolating and identifying bacteria, viruses, fungi, and parasites. Their findings are vital for diagnosing infections and guiding antibiotic therapy that is crucial in the fight against infectious diseases. In histology, medical laboratory technologists are immersed in the microscopic universe of tissues and cells. They process, cut, embed with wax, and stain thin slices of human tissue samples to uncover the structure of disease. Their work is critical in diagnosing many conditions from benign cysts to invasive cancers. In transfusion science, medical laboratory technologists ensure the safety and compatibility of blood and blood products for transfusions. Their careful work supports life-saving procedures, managing blood bank resources, conducting blood grouping, and matching donor blood with recipients. In cytogenetics, medical laboratory technologists are immersed in the world of chromosomes, identifying genetic abnormalities that can lead to diseases. Their work helps in the diagnosis of genetic disorders such as Down syndrome, cystic fibrosis, and various forms of cancer by examining the structure and number of chromosomes in a sample. Their expertise is also crucial in prenatal screening, cancer diagnosis, and guiding personalized treatment plans based on genetic information. In cytology, medical laboratory technologists study human cells to detect health issues. They work with samples from different parts of the body, such as screening pap smears to look for early signs of cancer. This field is essential for diagnosing cancers, inflammatory conditions, and infections. In molecular diagnostics, medical laboratory technologists use genetic and molecular techniques to analyze DNA. They can identify a genetic condition, cancer, or an infection. Their work contributes to successful treatment. In most provinces, organizations called regulators regulatory bodies, or colleges oversee the medical laboratory technologist profession. Regulators are the guardians of public safety. Regulators are set up by the government to monitor and enforce standards in a profession. In healthcare, the regulations they enforce contribute to patient care that meets the highest standards of quality and professionalism. Regulators are established by law. Their responsibility includes registering or licensing medical laboratory technologists before they can work in a lab. They set strict rules for education and registration. This means that the regulator is responsible for making sure that all registered medical laboratory technologists have the right education and clinical experience, take exams that show they have the right knowledge, adhere to the ethical standards of the profession, and keep their skills up to date. But regulators do more than just set rules. Regulators are also responsible for continuously checking to make sure that medical laboratory technologists follow the rules and standards for the profession. Regulators work to prevent professional misconduct, which is any activity that could harm the quality of a medical laboratory technologist's work or their ability to perform their job well. If a medical laboratory technologist does not meet the standards, they can be required to take corrective action like additional training, or to be required to work under close supervision. And in some instances they may lose their registration to practice. Regulators protect patient rights with standards of professional conduct, including ones that protect patient confidentiality and consent. Ultimately, the work of regulators in protecting patient and public safety is foundational to the trust that Canadians place in our healthcare system. Their regulatory oversight and commitment to high standards help to ensure that care is effective, compassionate, and safe. As guardians of the public's safety, medical laboratory technologist regulators support a healthcare system that Canadians can trust and rely upon. Starting on a career as a medical laboratory technologist in Canada is a journey of dedication, skill, and rigorous standards. For medical laboratory technologists who were educated outside of Canada, and for those who are educated in related fields like biochemistry or microbiology, there is a pathway that paves the way to becoming registered to work in Canada. The pathway to becoming a registered medical laboratory technologist begins with thorough academic study and extensive hands-on training. To be registered, which is needed in most provinces before one can work as an MLT, applicants must pass detailed exams that test their theoretical and practical knowledge. The pathway starts at the CMLTM website, where people interested in becoming medical laboratory technologists can find out about this regulated profession in Canada. They can learn what these professionals do and investigate the different fields of practice. Here, they can also start the path to becoming registered. Applicants begin their journey by creating an account at the CMLTM website, providing information about their background and selecting their fields of practice. This step begins the personalized application process. The pathway includes a tool that helps applicants decide if they're ready to go through the application process. Applicants can submit documents that demonstrate their education and work history, their clinical skills, and their proficiency in English or French. After their credentials and prior experience have been approved, applicants must take an exam in each field of practice in which they seek to be registered. The exam measures their ability to apply their knowledge. Applicants who do not pass the exams can take courses to improve their knowledge and skills before taking the examinations again. This new pathway to work as an MLT in Canada is evidence of the regulators' commitment to excellence and public safety, ensuring that every MLT meets the high standards expected in Canada's medical laboratories. Regulation doesn't stop once a medical laboratory technologist is registered. It requires ongoing learning for medical laboratory technologists, like taking courses, attending workshops, and going to seminars to keep up with new developments in their field. At its core, regulation serves two purposes: protecting public safety while fostering innovation in medical laboratory science. The regulators establish the code of ethics for professional behavior, make sure technologists follow standards, and hold them accountable for their work. This helps MLTs follow the current standards and contribute to the evolution of healthcare. Think about a family whose life got better because a disease was found early, thanks to the careful work of a regulated MLT. Finding the disease meant they could stop the disease from getting worse by starting treatment right away. Or consider the rapid response of MLTs during the COVID-19 pandemic. They followed strict regulatory standards to track the virus, gave essential information that helped shape public health strategies, and played a significant role in saving lives. MLTs are at the heart of healthcare, making sure that every lab test meets strict regulatory standards for safety. With their specialized knowledge, they maintain the high quality of care you trust. They are the dedicated professionals behind the laboratory test reports you and your practitioner depend on.
Okay. All right. So that gives a really good overview, and I think sometimes it's nice to listen to somebody talk that's not just me. So thank you. So after the PLA is complete, CamelPer reviews the documentation. These are sort of the options of the outcomes that could happen. So the first is they would determine that there is equivalency. So that means the education and the work experience meet the Canadian MLT standards in that specific field or fields. And then you are eligible to write the CamelPer field of practice exams that are indicated. The second option is that there's gaps identified, and CamelPer would provide the applicant with an educational learning plan to help fill those gaps. And then once the applicant provides evidence of completion of the education plan, then CamelPer would provide the applicant with eligibility to write the CamelPer field of practice exams. And the third option is a mix of the first two options. So an applicant may find equivalency in, say, clinical microbiology, but might be not having equivalency in chemistry, for example. So then you have options at that point. So if you're equivalent in micro, but not equivalent in chemistry, you could either write the microbiology exam immediately while you work on the learning plan, the education plan for chemistry, or you could complete all the education plans first and take all the exams at once. And that's a choice that's left up to the applicant and what works best for them. And then I mentioned it before, but one of the large benefits of this new process, this CamelPer process, is that flexibility in the name, is that an MLT can be certified in only one field of practice or five, or any number in between, just based on education, work experience, and sort of the choices that the applicant makes along the way. So the other good news is that even though you might be, or an applicant might be in this PLA process, but not a certified MLT in the province yet, there are options to work in the field in Manitoba. The most common would be working as a med lab assistant. They're non-regulated, so they do not have to go through a certification regulatory program like CMLTM. They are responsible for the pre-analytical activities, and most of the blood draws are completed by MLAs. So internationally educated MLTs can apply for these positions. We've listed some of the major employers in Manitoba there: Shared Health, Dynacare, Canadian Blood Services, and these employers, it is a highly competitive field to get into. So the certification exam for MLAs right now is through CSMLS, and it is available there. CSMLS will do a PLA, a prior learning assessment for MLA to determine if there's substantial equivalency for writing the MLA exam. But having that MLA certification from CSMLS definitely helps you stand out to an employer when they're looking at all the applicants for specific jobs. So here is CMLTM's contact information. We're also on LinkedIn, Facebook, Instagram, where we'll provide updates and other, applicable information. There's some QR codes there. The big one is just a QR code to our website, our Facebook, and our LinkedIn. Okay. And of course, our phone numbers. And here's the CamelPer information, their phone number, email, and website. They're also on LinkedIn. So a couple different sources for information. Okay, so if you have any further questions, I can do my best to help you with those.
Thank you, Jenny, for that informative presentation. Yeah, now we will open up for the audience. So if you do have any questions, again, please type your questions in the Q&A panel or chat or raise your hand and I will unmute you. Thank you, Agatha. Agatha is saying thank you, Jenny and the team.
Thank you for attending.
So while waiting, Jenny, I do have one question. That's me, Luna. And what's
Yeah.
the average length of the time that takes for newcomers to become licensed? Like the average from your experience.
So because the CamelPer process is so new, I don't think there really is an average length of time at this point. We just started the CamelPer PLAs. They just started last year.
Oh,
So there really hasn't been enough time to determine that. But I do know it does take some time, especially I would say most of the applicants from what I've seen do require some sort of education learning plan. So then it takes, depending on what their plan looks like and how long it takes them to get through that.
oh, so there will be
Um,
assessment done before what they can do with the licensing process.
mhm,
Nice.
mhm. Yeah, and the other thing that I didn't mention, um, and I'll go back and add, but the CamelPer exam is actually offered 4 times a year. So if you miss it, like if your learning plan is not quite done or your PLA is not quite done in February, then you should be able to catch the May sitting of the exam, right? So there's 4 options a year to write those exams.
Oh, that's good to know. Yeah.
Mhm.
Thank you, Jenny. And we have a question from Agatha. They're asking, I have a PhD in molecular genetics. Do you know my chances of passing the PLA? And I have experience in the laboratory, but more as an analyzer slash reporter, dry lab than wet lab.
So yeah, no, I wouldn't, without doing a full analysis, we wouldn't be able to tell you what your chances are, but it does sound like you would be a good candidate for the PLA process. for sure. So if you haven't been in touch with CMLTM yet, I would highly suggest creating an applicant profile and getting that started. Yeah.
Okay, thank you. Again, if we can also allow your mic if you want to ask your question. You just have to raise your hand and manually unmute yourself from your side as well after I unmute you. Okay. We have another question from Gito, if I'm pronouncing your name correctly. They're asking, I'm certified and registered with American Society for Clinical Pathology, ASCPI, and
It's,
I'm exempted to take CMLTM exam. Am I exempted?
are you exempt? I I don't know the answer to that question. Yeah, I'll have to find that one out. Thank you. I can circle back with you, Luna, and then if you're able to share that with them.
Okay, yeah, for sure. So
Thanks.
Gita, I will forward that once I get the answers from Jenny. We have a question from Jerry. Jerry is our career navigator. I've allowed your mic, Jerry. Please unmute yourself from your side. Hi, Jerry. I can see your mic is unmuted. You're a little bit far. Your voice is a little bit far.
Sorry, yeah, my microphone
Yeah,
was up.
we can hear
Okay,
you now.
so yeah, sorry about that. Anyway, so if there are clients who are, I mean, in terms of the recency of practice, they have been away from their practice for more than 5 years. So what are their options to gain and or re-entry to their profession?
It would actually be really similar. They'd have to go through the prior learning assessment process, and then
Okay.
from that they would come up with a learning plan. But for that, it would be for sure a learning plan outcome.
Okay. Yeah. So they need to go through like maybe an educational program or a bridging
It's it's
program.
it's possible. Y- Yeah, CamelPer will have like the more details about that. Again, with CamelPer process being so new, um, we're sort of still figuring out the relationships. So,
Mhm.
for example, right now I know Michener University in Ontario has a bridging program, but
Mhm.
they only accept Canadian applicants. So it's
Oh,
really not very helpful for us. Yeah, it's not
I
very
know.
helpful. Um, so I know CamelPer is working, like actively working on learning plans and establishing more relationships with more educators. So they will be
Mhm.
they'll have the most up-to-date information on that. Yeah.
Okay. Thank you, Janie.
Yeah.
Thank you, Jerry. Thank you, Jenny. We have another question from Aramid. They're saying hello and thank you for this informative session. Regarding the equivalency of my diploma, Wes said that it doesn't recognize my institution. I would like to know if I can then do the equivalency through ICES because my institution is among the schools that ICES recognizes. So, do you get the question,
Um,
Jenny?
yeah. Again, that would be a question for CamelPer. they haven't shared with the regulators exactly which organizations they accept these through. So unfortunately, yeah, that'll be CAMLPR 2. Now, Luna, I can take this question back to CAMLPR and respond to you as well for you to share
Yeah, for sure.
with everyone.
We can do that. Yeah.
Okay.
Okay, let's go to the another question. Johan is asking if I cannot obtain official transcripts, what alternative documentation does CMLTM accept? And this is one. You want to answer this one
Yeah.
first? Yeah.
Yeah. So the transcripts, yes, CMLTM would need the transcripts eventually, but CAMLPR would also need them. So I don't know what CAMLPR accepts. But I know with CMLTM, we have accepted unofficial transcripts and then like a letter from the program chair or head. We've also accepted like the diploma or certificate as long as it has the seal on it. So yeah, for that, like there are a couple of options for sure. But yeah, reach out to us or to CamelPer if you have any more questions on that.
Okay, the second question from the same person, can a student copy be used as a supporting evidence while alternative verification is arranged?
With CMLTM, yes. With CamelPer, I'm not sure.
Okay, thank you. And there is a third question. What is a typical timeline for an internationally educated MLT to become licensed in Manitoba?
Yeah, and that's where, especially with CamelPer process being so new to the province and to Canada, really, we don't have really good timeline statistics available at this time. But I do know it does take some time. Um, this is why we like to provide information about working as an MLA in the province or in research or, you know, being involved in the workforce before being certified in Manitoba as an MLT, just as options. But yeah, I don't have an answer for that yet. Sorry, we need at least another year of information before I'll have a good answer.
Okay, great. Thank you, Jenny. Thank you, Johan, for your great questions. And we have Agatha in the Q&A. They're asking, are you able to help us with the documentation, like helping to check if everything is okay?
I don't know if that would be exactly how CMLTM would help you. But if you want to call the office and talk, we can definitely do that. But I do know like CamelPer does have their specialist on site that would review the documentation. But I mean, I'm always willing to have a conversation or to email back and forth, and try and give you all the tools that you can to succeed. Yeah.
Okay, thank you. We have another question from Mohammed. Good morning, good afternoon. Thank you for this informative session and for giving me the opportunity to ask a question with a higher technician diploma in biology obtained abroad. What are the exact steps or requirements to work as a laboratory technician in Manitoba?
So I guess it depends on the terminology is a little bit different in Manitoba. So in Manitoba, a technician, it would be more equivalent to the MLAs. But depending on your education, that could be equivalent to an MLT. I don't know. I'm not that's not my sort of specialty, but I would for sure start with a prior learning assessment, If you want to work as an assistant with CSMLS, they do prior learning assessments for lab assistants. And if you were looking at MedLab technology, then the prior learning assessment would be through CamelPar. So going to both those websites, or again, calling us to help talk you through your training and work experience, and we can do our educated guess on where to start. But yeah, we would need a lot more information to help you with that.
Okay, thank you, Jenny. Thank you, Mohammed, for your question. We still have few minutes. If you do have any questions, we will try to answer a few questions as well. Okay, we have another question from Mohammed. They're asking, is the laboratory technician profession regulated in Manitoba? And do internationally trained candidates need a license or a certification to practice?
So in Manitoba, so the technicians are the terminology that I'm familiar with are more equivalent to the med lab assistants, and they are not regulated in Manitoba, but it is a very competitive field to enter. So that is where I would recommend you take the CSMLS exam for med lab assistants. And in order to do that, I believe you would have to go through their prior learning assessment program on CSMLS website. So go to the csmls.org and start there by creating an account and reaching out to CSMLS about a prior learning assessment for lab assistants. But so that's my recommendation. But do you need a license or certification to practice? No. It's just a matter of being competitive in the market.
Thank you, Jenny. Okay, Mohammed is saying thank you. Thank you, Mohammed, for your excellent questions. We have another question from Jean. Thank you for the presentation. I am international regulated laboratory technologist, and I'm taking English courses to achieve the required level of English. I don't lose eligibility to the process of certification if it can take longer to achieve English fluency required.
Yeah, I think I know what you're asking. So while you're practicing, or I guess not practicing, while you're actively working towards your English, you're worried about losing the skills for certification to MLT. I guess my first question, if I was having this question in my office, would be, are you registered with CamelPar yet to start the PLA process? Even if your English is not at the level that is required yet, I would still start that PLA process now while you're working on it. Yeah, like that's it. It just depends on the length of time and education, your work experience. Again, it depends on so many different components. So yeah, that's all I would say. Would just be start the PLA process with Camel Partner earlier rather than later. And your English will come.
Great. So we're almost done for the session. I'm just gonna share. Of course, we're still open till the time allows us for any other questions, but I'm gonna share my slides. Just go on. We do have a very short survey that we can share with everyone. Yeah, here we go. So we do have a quick survey because our services are for free and funded by the Immigration Refugee Citizenship Canada and the province of Manitoba. Your feedback plays an important role in helping us improve and continue to provide high quality services. So please use the QR code, scan it, and fill the survey. Just for your information, our today's event is an information session, so you can just put that one in there as well. Okay, we have a question from Aramide. So please, I don't have answer for my preoccupation. Okay, let me check if you. So Aramide previously asked us if regarding the equivalency of the diploma with less, if he can do it. You said Jane for this one, you will get back to us, right?
That's right.
Yeah. Yeah. So Aramide, if you're here listening to us, Jenny will get back to me with the answers, and I will forward the um, answers to these questions and other questions um, to everyone who attended the session. Okay, yeah, thank you so much. Just in case if the code is not working, let me just put the link in the chat for the survey. Okay, Mohammed is asking, I'm currently based in Senegal and hold a higher technician diploma in biology. What are the exact steps required to work as a laboratory technician in Manitoba? And which immigration pathway would you recommend for someone in my situation?
So like we're unable to help you with immigration pathways. Um, that's sort of not our expertise. But for the technician diploma, I would start with the going to www.csmls.org and starting the PLA process there for MLAs.
Okay, yeah, great. I hope that answers your question, Mohammed. Yeah, thank you. You're welcome, Mohammed. Okay, for those of you who were looking for resume help, interview preparation, I'm going to share our website quickly as well. I hope you can see my screen. So please contact the front desk. For those of you who are registered, please contact your career coach so that they can help you with your resume, interview skill, and other skills that can help you to enter the Manitoba labor market. So if you don't know your career coach, please contact the front desk here or phone us. Or you can also visit in person at 271 Portage Avenue. If we do have anyone, like, for example, who was that? Am I right? you are outside Canada, if you're planning to come to Manitoba, we do have SOPA, so you can check the pre-arrival services that they have so they can share more information with you. And eventually, if you are to come to Manitoba, they can help you connect with Manitoba Start as well. And we do have like career navigators that can help you with the process and connect you with the licensing processes. And moreover, we do have our events in the event calendar. So if you go to our website, we do have events like this, webinars, info sessions, hiring events. So do check our website and the event calendar as well. By registering with Manitoba Start, you will get a personalized settlement plan and personalized career coach as much as you want. Like there is no limit where you can have the career coaches to coach you on your resume, interview, and many other services. And you will have also our job matching unit that can help you enter to the Manitoba labor market, where you will be connected with the employers. Okay, we do have two questions. We'll just quickly answer those questions, and that will be all because time is also past 1. So Johan is asking, what are the typical costs for the PLA upgrading programs and the national exam?
Okay, so let me go. That information is on the website. So to sign up for the application, the account, it's $175. And then I don't want to give you the wrong information. So just bear with me as I find it for you. It is on the website. Here it is. I'll put this link in the chat as well. So the account creation is $175. The prior learning assessment is $900. And then for the exams, it sort of depends on if you're taking a single field, like if you're just going to be taking hematology or one of the fields, or if you're taking all like a core, a bundle, they call them bundles of fields. So the prices there range from $475 to $989. But I'll put this link in the chat as well, and then you can get right to it.
That's great, Jenny. And they have like follow-up questions, Johan and Agatha. They are asking about the funding. Are there funding options or financial supports available for internationally educated MLTS?
Yeah, there are some funding options available. We have them on our website. Here we go. You know what, we just updated our website, so I have to find them again. I can provide you with the information, Luna, and then you can share that.
Okay, that will be perfect. Great. Thank you, Jenny. Thank you, everyone. Thank you, Jenny, for that very informative, engaging session, and everyone for your excellent questions. We will get back to you with all the answers and the information uh, after the session. But for today, we'll close. So, on behalf of Jenny from the College of Medical Laboratory Technologists of Manitoba and the Manitoba Start team, thank you everyone for attending and stay well. Have a great day. Thank you, Agatha. Thank you, everyone.
Thank you.